Hi, this is Justin, and I'm with Sachin here in Dallas, and on behalf of Alice in El Paso, and we're presenting to you the natural history of rabies, its prevention, and recommendations to control a hypothetical rabies outbreak in Harris County as part of our Epidemiology 3 project for the UT School of Public Health. A little bit of history on rabies. Rabies is one of the oldest known diseases. There's evidence dating back to ancient Egypt of rabies infecting people, and it's different than most ancient diseases in the fact that it was considered to be caused by the bite of a wild animal instead of by a bad spirit or a spell, which was common for most other diseases at the time. There was no treatment for rabies other than to try and put something on the wound to absorb the poison out until about the 1880s when Louis Pasteur developed the first rabies vaccine using a desiccated spinal cord of a dead rabbit animal. Uh, but since that time, there's been new vaccines that have been made, and there's been attempts that are made to control rabies. And today, rabies is coming back as a disease. And now we're going to talk about the diagnosis of rabies.
I'll take over from here. I'll probably talk about how to diagnose rabies in animals and humans. Talking about animal diagnosis in rabies, it's mostly tissue-based, meaning that you need to have a specimen of a certain body part, and the most commonly used body part is a brain. So the highest yield is obtained by testing certain portions of the brain, and these results are typically available within 2 to 3 days after the test. The best thing is to consult a local state health official following a potential exposure, and then he or she can help you determine the best course of action based on the current recommendations. When it comes to humans, there are many tests available to diagnose rabies ante-mortem, that is before death. These tests can be performed on different specimens like saliva, serum, the spinal column fluid, or certain biopsies of hair follicles. And the most commonly used tests probably are saliva and serum. Um, as mentioned in our case study, we have provided a big table of different tests, and I'll just list them quickly. The most commonly used test is a direct fluorescent antibody test, or DFA, where we use a portion of the patient's specimen and test for antibodies against that antigen. Then we can also do some histological tests. We can also do immunohistochemistry, and very few labs in the country do electron microscopy on the specimens. So as I said, most of these tests are based in a laboratory once we have a tissue available for diagnosis. When it comes to treatment of rabies in humans, of course, the treatment after exposure can probably prevent if the treatment is given promptly within 7 to 10 days of the possible exposure. It depends on if the disease is asymptomatic or symptomatic. Asymptomatic exposure involves post-exposure prophylaxis, or PEP, which basically includes cleaning of the wounds and then instant vaccination in terms of either active vaccination or passive vaccination within a few hours of contact. Again, there are three categories of exposure depending on how severe or how deep the wounds are, and they are category 1, 2, and 3. And then wound cleaning mainly involves cleaning the wound with plenty of water and soap after the exposure to reduce the viral particles, and irrigating the area with any kind of antiviral agent like povidone iodine. Now, immunization involves a combination of HRIG, or human recombinant immunoglobulin, and a rabies virus vaccine, which may be available in different forms. Now, the CDC recommends administering 1 dose of that immunoglobulin, or HRIG, and then between 3 and 5 doses of the rabies virus vaccine. The first dose of rabies virus vaccine should be administered at the same time as the immunoglobulin, and then the remaining doses, depending on how bad the wound is, they can be staggered over a couple of weeks, and they happen on certain days, which are like day 3, 7, 14, and 28, as we had summarized in our table. Then we had also included a table which showed different types of rabies vaccines and immunoglobulins, and they again depend on how the vaccine is made. So broadly, there are four categories of vaccines: the human diploid cell vaccine, and then we have a purified chick embryo vaccine. Then we have the most commonly used human rabies immunoglobulin, or imogam, and then we have a hyper-rab variety of the same immunoglobulin. Now, when we have somebody who has a symptomatic exposure, generally there is no effective treatment available for these people, because they eventually progress to the encephalitis phase or the paralytic phase of the disease, and the current treatment for these type of infections is mostly supportive. We talked about the Milwaukee protocol, and this basically involves in using powerful tranquilizers or sedative medication like ketamine to keep the patient free of pain and emotional distress. Treatment of rabies in animals is probably a topic for veterinarians, but to talk about it in brief, I would say again, rabid animals exhibits behavioral changes when infected, so we can easily identify them. They become aggressive, combative, and furious. Now, since the signs of rabies in these animals cannot be reliably interpreted, any free-roaming, high-risk animal that potentially could expose a person to rabies must be euthanized at once, and the brain must be submitted for inspection for rabies virus. Um, then we will probably talk briefly about prevention of rabies in the US. Prevention of rabies, talking about first in human beings. Now, because rabies is endemic throughout the continent, with an average about two human and between 4 to 500 domestic pet cases per year, rabies control is possible through, obviously, through prevention, which would be either primary prevention or secondary prevention, where primary prevention involves avoiding any kind of exposure to possible rabid animals through increased community awareness, as well as animal and human vaccination. Now, vaccination in humans involves pre-exposure vaccinations, which may depend on, as I said earlier, the exposure category of that person. Um, we had we had made a table in our article, which basically went over through the risk categories and the different types of vaccinations available. So we had talked about four different types of risk categories, which could be either continuous risk category, frequent category, infrequent variety, and then the last one was rare, where most of the populations are at have a very less risk of rabies exposure. And then we look at the risk category, the type, the nature of that risk, and then we can recommend some pre-exposure vaccinations to human beings. With respect to rabies prevention in animals, I think improved domestic animal control, including effective leash laws, domestic animal rabies vaccination, and stray animal collection, have always had a major impact in reduction of rabies cases in the country. Now, again, vaccinating domestic pets, including dogs, cats, ferrets, is always recommended. And then several precautionary measures may be taken to prevent exposure. Of course, you have to be a very responsible pet owner. Keep your animals up to date with vaccinations. Keep the pets under direct supervision, and do not allow them to roam anywhere where, again, they could be exposed to another rabid animal. Always seek help from your local animal control to remove any stray animals from your neighborhood. Then avoiding contact with either wild or unfamiliar animals. Do not ever handle or feed or unintentionally attract any unknown, strange, or wild animal. When traveling abroad, try to avoid contact with wild animals as far as you can. And never ever try to adopt wild animals or bring them to your home. And again, know your state rabies laws, which I think is one of the few recommendations that we have made in an article. I'll now go, I think Justin will take over and he'll talk about certain recommendations.
So the final part of this project is to discuss a hypothetical rabies outbreak that takes place in Harris County. Harris County is where Houston is located, and Houston is a densely populated area, but surrounding Harris County or surrounding Houston City is a lot of wild areas, including San Jacinto County and a Sam Houston National Forest, which has many kinds of wildlife in it, including raccoons, deer, squirrels, and feral cats and feral dogs. Now, the recommendations that we've come up with to decrease the spread of a hypothetical rabies virus outbreak in Harris County are as follows. The first thing we'd like to do is to find one of the animals that is infected and to determine exactly what strain of rabies it has. And then from there, we would spread oral rabies vaccines throughout Harris County, including the wild areas and also in the parks and other wild spaces within the city itself. And these vaccines are eaten by the wild animals, and then it makes the animal immune, and it would help to stop the spread. We would also encourage pet owners to vaccinate their animals every year instead of every 3 years, which is the current recommendation. So in summary, rabies is an interesting disease because it is spread through the bite of a wild animal. It's making a comeback in recent years because of various reasons due to changes in habitat of wildlife and encroaching of humans into more wild spaces. And so in conclusion, we would encourage you as public health officials to vaccinate your animals, and if you see a rabid animal, to warn other people to stay away from it. And so on behalf of Justin, Sachin, and Alice and our Epi 3 class, we hope you have a nice day. Thank you for listening.